Sandra and I are going to be presenting our paper we co-authored, Patients, Clinicians, and Researchers Working Together to Improve Cardiovascular Health, a qualitative study of barriers and priorities for patient-oriented research. We'd like to thank our co-authors and the patient partners who've been involved in this work, as well as the following organizations: the Libin Cardiovascular Institute, P2 Cardiovascular Health, Canadian Institute of Health Research, the Alberta SPOR Support Unit, Patient Engagement Platform, as well as the University of Calgary. So why work together? So the reasons for wanting to do this project is that working together enables both the patients and healthcare providers to co-create health and healthcare, ensuring that patient safety and there is improved quality in cardiovascular care. This was also an opportunity to gain an understanding of what matters to patients and to learn how patients' priorities align with clinician researchers in cardiovascular care, and how that can result in research and outcomes that are actually more relevant to both patients and clinicians. And therefore, the ultimate goal of the study was to identify health priorities for cardiovascular health research, while also building bidirectional patient-oriented research partnership in cardiovascular health and forming an advisory council to support future patient-oriented research at the Libin Cardiovascular Institute of Alberta. This was a qualitative, descriptive, and patient-oriented research. We had two frameworks from the Canadian Institute of Health Research Strategy for Patient-Oriented Research that really provided the foundation for this work: the patient engagement framework, as well as the capacity building framework. It was conducted with patients, clinicians, and researchers who were involved in generating topics for patient-oriented research, discussions, and priority voting and ranking processes. As I mentioned, the CIHR SPOR patient engagement framework provided the foundation for this work. And so our participants of this two-day workshop that you read in the paper, or if you haven't had a chance, that's okay, we'll go through the paper today, we're new to patient-oriented research. And so this was a new concept of patients being involved in health research. And therefore, the CIHR SPOR patient engagement framework vision is patients being active partners in health research that will lead to improved health outcomes and enhanced healthcare system. This was the message that was brought forward in the very beginning of the workshop, as well as the guiding principles of inclusiveness, support, mutual respect, and co-building. At the beginning of the workshop, we had set around some ground rules for working together and having that mutual respect and co-creation of research priorities, so that we were all there for the same goal, and we were all there with the message of working together and respecting each other as we in this process of the two-day workshop. Next slide, please. And so to give you an overview of what the two-day workshop looked like, so this was the overview of the study in identifying, refining, and ranking the top 10 priorities for cardiovascular health research. In day one, as the participants were new to patient-oriented research, we really wanted them to become comfortable with each other. And so providing that foundation for explaining what patient-oriented research was and how patients can be engaged in health research was first done in the day one presentation. And this was led by both a patient partner, Sandra Zelinsky at that time, as well as an academic, Dr. Mary Santana from our team as well. And so they co-presented the two-day workshop and led it to show how patient-oriented research can be done in action. What we had done for day one was first identify barriers and facilitators for patient-oriented research to kind of get the conversation flowing about what concerns participants had for being involved in this or engaged in this work, as well as for patient-oriented research in general. We also divided them into separate working groups. So we first had a working group for patients to identify their priorities, and clinician researchers in their own separate groups to identify their own priorities for cardiovascular health research. We decided to do separate working groups in day one, and for the reason that they were new to working together and they were strangers, and we wanted them to first become comfortable in sharing their views, sharing their ideas, and then coming together later as a group to discuss those ideas. So after the patients, clinicians got together with their priorities, we then discussed those priorities. We matched the priorities that were the same, and we also merged some of the priorities together that could be put together similarly in the same group or category. In day two of the workshop, we presented those top 10 priorities from both the patients and clinicians as a summary of those priorities. to the group to make sure that we ensured that we captured what they were thinking and what they had discussed the previous day. We also in this group, we decided to have working groups that involved both clinician researchers as well as patient partners. And this time they were already comfortable discussing their priorities as a larger group. And this time they got the opportunity to actually work together to develop a Dragon Den style pitch. And so this was done based on the reality hit show Dragon's Den, which is a competition style show to pitch a product to judges. And similarly, with this concept, we wanted the participants to be able to pitch their priority. And so they looked into identifying, in their pitch, they talked about the relevance, the feasibility, and importance of that priority, and then pitched their priority to the entire group for discussion as well. Next slide, please. And so the participants of our Working Together 2-day workshop were a total of 23. So we, just to note that we are calling them participants for the sake of this being a qualitative study, and as mentioned, as written in the paper. However, this whole workshop, the aim was to build capacity to be partners. So by the end, we all become partners in working together. At the beginning, they are participants of attending this 2-day workshop, and that's why we're using this language here. So we have about 10 patients who attended, equal mix of men and women with cardiovascular health conditions. We had caregivers. We had 7 healthcare providers, physicians and nurses with specialties in cardiovascular care, as well as 4 health services researchers in the Working Together participant workshop. So as I mentioned, one of the first activities was to outline what the barriers were to patient-oriented research, and then also identify those solutions so that we keep those in mind moving forward for future patient-oriented research, as well as for the work that we're doing in this 2-day workshop. And so one of the barriers that was highlighted during this workshop was a lack of awareness of the existence of patient-oriented research, that this existed, that patients were being involved in research. Participants noted that this was the first time that they were involved in a patient-oriented research project. And so an identified solution to address this gap was building networks with existing patient, family advisors, reaching out to different communities, connecting with healthcare providers to not only disseminate information about patient-oriented research to their patients, but also to get them involved in patient-oriented research projects as well. And also using social media as a tool for wide dissemination of opportunities for patient-oriented research. Another barrier that was identified was a lack of understanding of the role of patients. Where do patients fit into health research? In doing so, in highlighting this barrier, it was noted that we really need to set clear expectations and roles for engaging in patient-oriented research, and also include a protocol for conducting patient-oriented research. Similarly to research protocols, where this is given to research team members about how the research is going to be carried out. Similarly, we need patient-oriented research projects to embed POR within research protocols and to highlight exactly the role of patients throughout the research. Access and opportunities to participate in patient-oriented research, such as due to distance or lack of time, may be a barrier. And ensuring that we accommodate patient partners using technology such as email, phone, to allow for virtual meetings is something that was identified as a solution, and what we see has been going on for the last year or so due to COVID as well, more increasingly. Diverse backgrounds was seen as both could be potentially a barrier, but also seen as something that was necessary to engage in patient-oriented research. Diverse backgrounds in the sense that the participants, they were all coming from different walks of life in terms of clinician researchers were coming from more of an academic background, patients had their experience and they were sharing their experience. And so there was some concern, or there were just some ideas thrown out that how are we going to work together to come with and identify these priorities. An identified solution was that we needed to work together with a collaborative mindset. So a common goal of ensuring that we were creating or identifying the top 10 priorities that were relevant to our participants and that would be beneficial for patients and caregivers as well. And also to ensure that there is diversity in in the different perspectives. We do want to hear from different types of people in different types of education backgrounds, ethnicity, age, working status, sex, and gender, to incorporate multiple perspectives and to ensure that the priorities are relevant for all. Thank you. Next slide. And I'm just going to give it off to Sandra.
Thanks, Sadia. Thanks for setting the stage. So we're just going to get into a little more detail with each step. And I'm just going to sort of share in a bit of a storytelling fashion and walk us through this. So in our 2-day workshop, after we did, so Sadia just talked a little bit more in detail about identifying barriers and solutions to working together. And then we really went into identifying research priorities in cardiovascular care. So that's earlier, Sadia alluded to the idea of separating the groups. So this is where the groups got separated. They had the opportunity to really brainstorm and discuss all the ideas, all the priorities that would be important to them in cardiovascular care. And so this is the visual of what came out of the patient priorities, patient family caregiver priorities, and then the unique priorities to the clinician researchers. In the middle, actually what happened was that we had 5 matched priorities. So it was sort of relatively easy. It was already agreed upon, making those next steps a little bit easier for us as well. So this is just a snapshot of those priorities. As you see, the patient and family caregivers identified access to care, integration of care, experience of care, structured for patient-to-patient support and patient advocacy, and rare heart disease. And we go into a little bit more detail explanation in the article if you want to sort of circle back and review them. The clinician researchers identified collecting and reporting of patient-reported outcome measures, so PROMs, and patient-reported experience measures, which we refer to as PREMs. Technology to predict and prevent cardiovascular disease, and patient and caregivers' perceptions on the role of technology in patient engagement. And then the matched priorities, so both groups agreed on continuity and transitions of care, communication, tools to support shared decision-making, and patient engagement and prevention and prediction. So from there, what we did is we had all the priorities identified by both groups along with the match priorities on the wall, and we have some visuals coming up, so you'll kind of see a little bit of the process that we went through for that 2-day workshop. But we did what's called dotmocracy. So it's a dot voting type exercise to help to create an equal voting voice, I guess, and it's a participatory large group decision-making tool. And this tool has been used in priority setting, particularly with large groups, so 20 to 30 participants, as a method to recognize points of agreement. So dotmocracy allows participants to be fully engaged in the research process, especially if they have not participated in research before. And what we did is we gave each participant so many stickers and asked them to go and identify the priorities that were most important to them. And then in the end, and you'll see just coming up shortly, we were able to determine the priorities that were higher from the group and that sort of fell lower for research. So here's a visual of working through sort of that whole priority setting and dot voting exercise. So as you see on the wall, I think you could probably see my cursor here. These are all the priorities. We have sort of put them on the wall. You know, we have some flip chart notes, some discussion points that came up, but the priorities here, and then you can see the stickers that people have voted on each priority. And so just even at a quick glance, you can see some of them that were prioritized lower and some of them that were prioritized higher. So then we calculated how many votes for each priority, which helped us to determine which priorities to focus on as we move forward. And the whole point was to start narrowing down to those top 10 priorities. And then from there, once we determined those top 10 priorities, what we did is we paired patient, family caregiver partners up with clinician researcher partners to develop those dragon den pitches that Sadia referred to earlier. really focusing on the relevance, importance, and feasibility of each priority. And so this was an opportunity to learn from each other. So the clinicians, for example, the clinician researchers, were really able to, in certain instances, build capacity in the patient research partners to explain the feasibility of a research project. So that could be money. How much would this type of research cost? How long it might take, so time, and really to have those discussions. And then the importance can come from both perspectives. So they're co-developing that presentation. And then the relevance of each priority. And so they're working on their script in this picture to then spend a few minutes presenting their priorities. And I just want to also mention that each group was able to choose a priority that they would prefer to present, so something that resonated with them. So these are our results. We ended up with our top 10 priorities, and they were empowering patients with knowledge for shared decision-making, technology, equal access to care, improving communication, prevention and prediction, continuity and transition of care, improving the experience of care for patients with cardiovascular disease, structures to better support patient-to-patient support and patient advocacy, patient engagement and involvement, and rare heart disease. So we did have some patients within our group that have experience with rare heart disease and really expressed the difficulties of accessing information and connecting with people. And she actually had a experience where she had to search all over Canada for a specialist that could help her with her specific condition. So really highlighting the importance of, you know, of also studying the rare heart disease conditions too. Actually, I'm just gonna hang on 2 secs. I'm just gonna pause this for a sec and get this set up. So just want to, whoops. Okay, I'm gonna back up to the video. I just wanted to hold for a second. So you'll notice the voices in the video are a little lower. If you raise your volume on your computer to make sure that you get the maximum volume. This video is just a snapshot of sort of the Dragon's Den pitches and just provide an overall vibe of some of the work that we did together. So I'll back up the slide and we'll just back this up to the beginning.
And then transitioning and everything else. We looked at an advocate person, like a navigator. Someone mentioned that.
Understand where somebody encountered a barrier in their care, and then you could reflect upon a person who didn't encounter that barrier, and you could actually start to design the strategies that would actually improve the transition of care between the hospital and the community. So I always
To us is empowering patients so that they can make better decisions.
So that just shows a little bit of the Dragon Den pitches. We had 10 pitches with, and each pitch took approximately 6 to 10 minutes each, which really allowed for the group to have further discussion about which priorities that sort of the low-hanging fruit that they could focus on first. So for example, if it was going to be a little bit easier, take less time, and perhaps less money, you know, easier to get the funding for it, they could focus on some priorities first and then look at some of the other priorities for future research as well. And so we just really like to acknowledge the whole team that were a part of this project and have been working together. So we continued on as a patient advisory group for the Live-In Cardiovascular Council. We worked together over the next few years, and we still continue to have engagement with all of the individuals that have been a part of this process. And so we have a few discussion questions. I will copy and paste those into the chat box, but we also welcome all of your questions and comments. And so we can start off with your questions, or if you want to sort of think about the questions that we've put together to sort of start the discussion off. We sort of just put 2 questions together. So what do you think about the methods used for this project? What other methods could have been used? And then in the discussion section of the paper, we state another study limitation in conducting patient-oriented research is related to the fact that the 2 groups, so patient and clinician researchers, are not accustomed to working together, and therefore it is possible that they inhibited or censored themselves in contributing their ideas. So what kind of engagement strategies could have helped to mitigate power dynamics between team members which could include patients and families? So I will copy and paste these into the chat box. I'm just gonna end on a contact us and thank you for your attention during the presentation. So if you wanna get a hold of Sadia and I, these are our email addresses, and I'm gonna stop sharing the slides. I'll copy and paste that in the chat box, and we welcome any questions